share with you two very different experiences. In the first scenario, a practitioner who caters to the Orthodox Jewish community offers the HPV vaccine to a select number of people, those who she feels would not be offended by the topic, as she carefully dances around her wording by which to provide an understanding to the patient's parents. The vaccine is not offered to any males. To assuage parents' discomfort, she attempts to explain that perhaps your child may marry a convert or someone who did not grow up religious and observant of Torah law their entire life, but became observant later on. In the second scenario, a practitioner who has a more diverse population enters the room to perform her normal 11 or 12-year-old annual exam. She offers the HPV vaccine along with all the other age-appropriate vaccines to all of her patients, both male and female, without any bias. She explains to them that the HPV vaccine is to protect against cancer. Should the parents have any follow-up questions, there's no hesitation in providing the information. But the emphasis is placed on the vaccine's purpose, which is to protect against cancer. Back to that first scenario. By attempting to be culturally sensitive, the practitioner deprives the parents of the opportunity to make an informed decision for their children. Some parents are not even given the option at all. The vaccine is approached with a taboo. By treating the vaccine in this manner, an emphasis is placed on this being an infection that is sexually transmitted. And individuals in the Orthodox Jewish community are therefore not likely to contract it as we practice monogamy. These are not just hypothetical examples. This is what I experienced firsthand as a clinician at two different practices. Personally, I felt offended for the Orthodox parents. Are we not able to make educated decisions on behalf of our children? The HPV vaccine is to protect against cancer. That is the bottom line, and that is what you need to understand. When confronted with the question, do you want to vaccinate your child? The practitioner is asking if you want to protect them against cancer, a serious illness that can oftentimes lead to death. Most everyone knows someone who has suffered with cancer. Some have had better outcomes, but many are not so fortunate. If you have the ability to protect your child against cancer, wouldn't you want to take it? To date, there are no other vaccines that protect against cancer. Now that I've gotten your attention, let me break this down for you. I intend to provide you with some education on human papillomavirus, the infection itself, and on the vaccine, while noting the cultural pieces to our community. I do voice a disclaimer that I will be using some sensitive language. I recognize that by using some anatomical terms that may seem to contradict the cultural sensitive objective. But the terms are just that, anatomical names of body parts. So I am speaking to you as a doctor, as a professional from a doctor's office. As a practitioner who has an Orthodox Jewish background and am aware of the discomfort that some may have with the vaccine and this topic, I implore other practitioners to desexualize the vaccine. It is not about protecting against STDs, sexually transmitted diseases, which, by the way, it does offer some protection against that as well. But it's about protecting against cancer. HPV is responsible for mouth and throat cancers, including the base of the tongue and tonsils, anal, rectal, penile, cervical, vaginal, and vulvar cancers. I just named 8 separate cancers. Cervical cancer, which HPV is most commonly attributed for, is just the tip of the iceberg. What is HPV? HPV stands for human papillomavirus, or warts. HPV is a group of more than 150 related viruses. It affects both males and females. Some may have the misconception that males can only serve as carriers, but as I mentioned before, HPV causes oropharyngeal cancers in addition to anal, rectal, and penile cancers. That's in addition to the female ones. Infection from one type of HPV does not prevent infection from another type. There is no treatment for HPV infection. The most effective therapy is prevention by means of vaccination. Infected persons may have no signs or symptoms. Most people are unaware that they are infected until it is too late. They have already transmitted it to others. Symptoms may appear years after infection. So, how is HPV transmitted? Through intimate skin-to-skin contact. Can it be gotten by other means? I want to be very clear that intimate skin-to-skin contact is not exclusively through the act of vaginal intercourse. It can also be via an oral transmission, for example. Another means, which is not very common, but may occur, is transmission from a pregnant woman to her fetus during delivery. The child might develop recurrent respiratory papillomatosis, RRP, a rare but dangerous condition where warts caused by HPV, similar to genital warts, grow inside the throat. Someone could be exposed to a contaminated object in a doctor's office that was not properly sterilized. How prevalent is HPV? All of the numbers that I am quoting to you are of the people who were not fortunate enough to ward off the infection, and it is the persistent infection which is the mainstay of the development of cancer. Nearly 80 million Americans are currently infected. That is 1 in every 4. About 14 million people in the US become infected each year. HPV causes 33,700 cancers annually. 12,000 women are diagnosed with cervical cancer. 4,000 have fatal outcomes. 19,400 women and 12,100 men are affected by other HPV-causing cancers. High-risk HPV types are detected in 99% of cervical cancers, meaning if you know of anyone who has had cervical cancer, it is likely due to HPV. HPV vaccine is recommended as a 2-dose series for males and females 11 to 12 years of age. It can be administered as early as age 9. Like all vaccines, we want to give the HPV vaccine earlier rather than later. Getting the vaccine now protects your child before they are exposed. Additionally, the immune response among preteens is superior. Newer guidelines just expanded the age available for patients to receive the HPV vaccine up until age 45. Practitioners are advised to offer HPV vaccination in the same way and on the same day as the other adolescent vaccines. Allow me to role play. Your child is due to receive vaccinations to help protect against meningitis, HPV cancers, and whooping cough. If your practitioner does not offer it at that time, don't be shy. Speak up on behalf of your child. By dealing with it in this manner, you protect your child prior to the topic even becoming a discussion. This is in no way a license for kids to engage in early sexual behaviors. How does one become aware that they were infected by HPV? There are no screenings available for HPV-related cancers aside for cervical cancer. Let me repeat that because this point is critical. There are no screenings available to detect HPV-related cancers. You only find out once you are diagnosed with cancer. The one HPV-related cancer that can be screened for is cervical cancer, and that is done by means of the Pap smear. Hopefully, all women hearing this have awareness of Pap smears. A Pap smear is a tool to screen for precancerous cells recommended for all women ages 21 to 65 every 3 years. As many women in the Jewish community have a number of children and seek regular OBGYN care, this is something that is included. As HPV cancer usually does not have symptoms until quite advanced, is very serious and hard to treat, it is important to have regular screenings for cervical cancer. Now I ask you, if you are willing to have a Pap smear done to detect whether or not you have developed precancerous cells, why would you not take the step before by vaccinating, which is considered cancer prevention? Would you not advise your daughters to have a Pap smear performed? So now let me educate you on the vaccine itself. There are currently 3 HPV vaccines licensed in the US. Since HPV vaccination was introduced in 2006, HPV-related cancers and genital warts have dropped 71%. The HPV vaccine is made from one protein from the HPV virus that is not infectious, it cannot cause the HPV infection, and it is non-oncogenic. It does not cause cancer. The vaccine is very safe. Over 100 million doses have been distributed in the US over the last 10 years. All medications or vaccines have some risk of side effects. The most common are pain, redness, and swelling at the site of injection, akin to any other vaccine. Other side effects include dizziness, fainting, nausea, or headache, which is most often associated with anxiety of receiving a shot, also similar to any other vaccination. The vaccine is not, I repeat, it is not associated with any serious side effects. The benefits far outweigh any potential risk. Lastly, I want to address the needs assessment for our community. Many may wonder, why is it necessary to give to our children when HPV is still in the class of sexually transmitted diseases? It is believed that our children are not at risk due to our religious and cultural practices of monogamy and no premarital sex. So let me address this head on. Firstly, to date, data of prevalence among the Orthodox community is not collected, but one study out of Israel found that the causative agents and liable behaviors were the same in the Jewish community and the non-Jewish communities alike. Other issues which plague our communities are domestic, child, and sexual abuse within the community, rape victims from both predators within the community and outside the community, and varying backgrounds of individuals that may or may not account for behaviors which we cannot control. Some of these backgrounds include individuals who convert to Judaism, were not raised religious but became observant of Torah law later on in life, or were raised religious but may have transgressed at some point. Many of our holidays and practices involve the use of alcohol. Some even seek spiritual experiences via drugs, which may affect a person's inhibitions. Even persons with multiple marriages, the more exposures, the more risk. Additionally, there are a plethora of documented cases of sexually transmitted diseases within the community, and undocumented cases as relayed by practitioners who are treating infected persons. The bottom line is, we are not able to predict our children's future behaviors, the increasing acculturation affecting our community, or to account for who our children will inevitably marry and what that person has been affected by. A topic for another discussion is the need for our community to face challenges of 2021. We are not immune to them. There have been increased efforts to speak out about some of these topics: addiction, mental health, domestic and sexual abuse. Allow me to paint a picture. Can you imagine, God forbid, that a child has been a victim of rape and 30 years later they develop cervical cancer? From that experience, they continue to be victimized down the road. Likely, they were too ashamed to even tell someone about it. And that person may have been exposed to things beyond her control, and it only comes out years later after marriage, when the spouse is now affected too. To reiterate the key points, there is no significant risk of vaccination. The vaccine is safe. The vaccine needs to be desexualized. The benefit is to protect our children, despite whether this particular group is at lower risk. We are still at risk. Hashem has given us the means of protection. It is our hishtadlus to use it. HPV vaccination is cancer prevention. Thank you.